Renal cell carcinoma can exhibit a unique vascular tropism. And while this phenomenon of tumor thrombus formation and extension has been most commonly described in clear cell RCC, non-clear cell RCC subtypes can also display this invasive growth pattern. The standard of care in this setting remains surgical treatment with radical nephrectomy and tumor thrombectomy. Most outcomes described in the literature after surgical treatment have been restricted to clear cell RCC. And this is mainly due to the lower incidence of non-clear cell RCC as well as the greater heterogeneity of this disease. Given this paucity of literature, we sought to describe survival outcomes and describe the impact of histology on these survival outcomes in surgically treated patients with renal cell carcinoma and tumor thrombus extension. To do so, we utilized the SEER database, which luckily started capturing data on major vein involvement in 2010. And we were able to identify a large population-based cohort of patients with renal cell carcinoma and tumor thrombus extension that were treated surgically. We restricted our analysis to node-negative, non-metastatic disease. And we were able to compare both overall survival and cancer-specific survival by histology. In around 6,500 patients and over a median follow-up of 3.2 years, we were able to demonstrate that there was no difference in both overall survival and cancer-specific survival by histology. There are major limitations to our study, most notably the lack of data on systemic therapy in SEER. And this is important, especially after the approval of adjuvant pembrolizumab in the space of clear cell RCC at high risk of recurrence. However, it is important to note that our analysis preceded this approval as it was limited to patients between 2010 and 2021, and approval by the FDA was given in 2021, thus eliminating the confounding impact of this factor. However, very important to note. In conclusion, we were able to demonstrate that patients with tumor thrombus arising from RCC demonstrate comparable survival outcomes irrespective of histology. This is important and highly, emphasizes that surgical treatment is feasible for patients with non-clear cell RCC, but it also highlights the need to look into more multimodal therapy options, especially in patients with non-clear cell RCC.